All right, everybody, thank you for being here today for this presentation for Go Red Month. We're going to talk about women and heart disease. And so we're going to talk a lot about how women typically present very differently when it comes to heart attack than men. And so how a lot of these things go missed, unfortunately. So I will start off with sharing a brief little video clip of
It started out like a totally normal day. Mom! Okay, move objection deadline to the third line after survey. Oh, honey, for when you always use the verb estar. What are you doing down there? Did you finish your breakfast? Ow. Whew. Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
Oh, you sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Wear your shoes. Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh, my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her. Nobody move. I'm getting a dustpan.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9. 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
That's a fun little clip. Obviously, we're not making light of having a heart attack, but it just makes light of some of the symptoms and how they do go unmissed a lot of times in women. So today, in honor of Go Red Month, we're going to talk about overview of heart disease and the unique risk factors for women, signs and symptoms and diagnoses, how that comes about, prevention, lifestyle changes, treatment and management, and obviously awareness and advocacy, which is why we're doing this. So to give you an overview of heart disease, there's several different types. Heart disease encompasses like coronary artery disease, to name one, where there's narrowing of the arteries that affect the blood flow to the heart muscle. Heart rhythm problems or arrhythmias. Some people might know of someone that has atrial fibrillation. Heart defects, like where the structure of the heart is altered, and so it affects how the heart functions overall, such as like some people might know of someone with mitral valve heart disease, which is pretty common actually. And then again, types of heart disease: coronary artery disease, valvular heart disease, like I had mentioned, congestive heart failure, where the heart does not squeeze enough. And so that results in like a backup of fluid ultimately into the lungs and, into the legs and the feet. So the impact on women, so it's estimated that in 2021, 1 in every 5 female deaths was caused by heart disease. And roughly 44% of women in the United States are living with heart disease. And globally, it is the leading cause of death worldwide. And so there is an increased need for awareness. And as my colleague will further mention, some of the other statistics about how this often goes undiagnosed, missed and undiagnosed in women when they come to the ER or other treatment centers. So some of the unique risk factors: hormonal and biological differences. And so estrogen. So women with low estrogen have a higher increase of fat that gets deposited into the arteries, which increases the risk for stroke and heart attack. Pregnancy-related complications. So gestational diabetes can also increase your risk for heart attack. Preeclampsia, which is a severe elevation in blood pressure during pregnancy, and that puts a lot of stress on the heart. And then obviously the need for long-term health monitoring. So menopausal changes are some of the hormonal changes that are mentioned. And so low estrogen can be a real big major contributor to having an elevated risk of heart disease, and making this very essential to treating. So that if you have or are in menopause, you might want to talk to your healthcare provider about getting on some hormones, because it can improve your quality of life and also your risk for heart attack and stroke. Symptoms and diagnoses. So fatigue is very, very common and it's very overlooked most of the time, because women, unfortunately, it's like, oh, you're probably just really tired. You work a lot, you have kids. And so a lot of times it's just blown off or misattributed to stress. Shortness of breath is really common, and nausea and GI symptoms, as you saw in the video, indigestion, gas, just feeling like this burning in your chest. A lot of times it's actually pretty common in women, and hence why it goes overlooked most of the time. And you can go and have an EKG that looks relatively normal, and you have these symptoms, and a lot of times just gets overlooked. It's pretty unfortunate, actually. And so again, the gender differences are the variability in how men present. Typically men are classic, the arm and the jaw pain and the crushing chest pain, and a lot of times they're very, very sweaty and short of breath. It's a lot of times pretty obvious. And so this can impact diagnosis, because if you don't suspect that a woman's having a heart attack because she just has a little gas and a little tired, then you can miss this, and it can really impact her health long term. It's pretty unfortunate, actually. And so some of the tests that might be done: blood, there's some markers in the blood. EKG is really important, but however, it's not 100%, because there are normal EKGs that I've seen, and the woman's having a heart attack. It's unfortunate, but I've seen it. Echocardiogram, where it's an ultrasound that looks at how the heart is functioning and pumping. It's supposed to pump in concert, so very organized. And so you might be able to pick that up on an echocardiogram, although it's pretty late by the time that happens. So meaning like the heart attacks evolved by that point. But that is a diagnostic tool, and stress test, which is also typically a later diagnostic test for heart attack. A lot of times picks up old heart attacks. Prevention and lifestyle changes. This is some of my favorite topics to talk about as a nurse practitioner and a holistic health coach. I love talking about diet and lifestyle, because it's very, very important how just by limiting the amount of processed food you might eat, anything that comes in a package, processed starches and sugars and carbs and things of that nature, can really have a negative impact on your diet. They create a lot of inflammation. The excess sugar is really not healthy. And so you want to focus on eating whole foods, a diet balance of whole foods and fruits and vegetables. I'm sorry about my cat. So this is a very important topic. And so a lot of people would say that, oh, I don't really have time. And I understand that, if you're really busy, you have kids and you're running all over the place between practice and school and what have you, or you're running a business. It's not impossible though. And so really paying attention to what time you have, maximizing the time that you do have, and putting good things into your diet can really, really mitigate a lot of the risk and improve your outcomes. God forbid you do have a heart attack. Physical activity and exercise, obviously this should be a no-brainer to a lot of people. I'm sure many of you have heard your doctor mention, even if you just walk a few minutes a couple times a day, where you're just got this pace where you're a little bit winded, but you're able to have a couple of word conversation, but it's a little bit winded. That's a great indication that you're getting a good amount of cardio, where the blood is pumping, the heart's getting some exercise if you do a couple days a week. And so, people say, I don't have time, but you could squeeze in 15 minutes a couple times a day. And like I mentioned, I find myself going down the drain of like cat videos. So if you just get out there a few minutes, get out there, get some exercise, it can really have a good impact. Walking, I mentioned cycling is really good, swimming. And little known fact, some people, who live in the Northeast, it's very cold out right now and don't like to walk in the cold, which I totally understand. But if you live near a mall, I believe they still have like the Mall Walker Society. So you can just get in there, it's warm, get your exercise, 15 minutes, and be on with your day. Do it a couple times a day. It can be really impactful. Take the stairs, things like that. Impact of chronic stress. We are all under a lot of stress. I mean, it's New Jersey or United States, but I live in New Jersey, so it's like a badge of honor here. And so it does negatively impact. So many of you that have busy lives can understand, like when you sit down at the end of the day, you finally have a chance to out breath. And it's just like all of this comes out and this weight just comes out. So making sure that you have some way to mitigate your stress every single day, whether it's journaling, if you have nosy family members, rip up the page, throw it out. Meditation, if that's your thing, getting outside, walking, yoga, talk therapy, or having a friend where you could just like vent to for 15 minutes, just like, I got to get this off my chest, can be really, really helpful. Because stress does affect the heart and the overall health of your body. Treatment and management of this. So it depends on what caused this. So the focus of my role as a healthcare provider is, why did this happen? I mean, obviously, if you go into the ER, they're going to want to know, why did this happen? Is it from high cholesterol? Is it blood pressure? Do you have a structural problem? But the treatment will depend on what caused it. And so if you have high cholesterol, they're going to put you on a cholesterol medication. They're going to make sure that you modify your diet. They're going to manage your blood pressure. The point is, you want to make sure that whatever caused it is how your treatment is targeted. So if it's cholesterol, then it's diet and the medication. Same thing with blood pressure. If it's structural thing, then unfortunately there's other treatments involved, like typically like surgery. But you just want to make sure that you're getting the treatment personalized for your needs. Surgical interventions. So angioplasty is where it's like some people might call it the roto-rooter, where they go in and kind of break through the plaque and separate it and push it up against the blood vessel walls so that you can restore blood flow. The whole objective of managing a heart attack is time is tissue. As an ER nurse for over 10 years, that is what's ingrained. It's like you get the patient in, you take their labs, and you get the patient to where they need to go, because time is tissue. So the sooner you can restore blood flow, the better the outcome. So angioplasty, excuse me, people might know them as stents, are real important, because it's a mainstay of treatment right now. You get in, you open it up, and you restore blood flow. Bypass is a little bit more extreme, and that is where they actually, think of like a traffic jam in the middle of a road. You take a blood vessel from your leg most commonly, and you create like a jug handle around the clot, restoring blood flow, and just completely bypassing the clot. And then informed health decisions. The reason why we're doing this is so that you are educated. My passion with my patients is to make sure that they know what they're getting themselves into, why this is happening. You want to know what your options are, and you want to advocate for yourself. So if you're a person, you're like, I just don't feel right, or it's your loved one, you're like, you just don't look right, and they're not acting right, you make sure you advocate. And if you are not getting your answers, you go to someone else. Long-term care and monitoring, again, this is all going to be dependent on what caused it, but if you end up with a stent and you're on medication, you just bought yourself a every 3-month visit with your doctor, and they will track you pretty regularly. And there's definitely, and there should be always collaboration with other healthcare providers. Maybe it's a nutritionist to help you get your nutrition on point, or maybe it is the person that manages cardiac rehab helping you get your physical activity back, if not better than before, so that you can maintain an exercise regimen and strengthen your heart. Because the goal of recovery is to maximize your recovery so that your quality of life is restored as best as it can be. Awareness and advocacy, again, this is about empowering women and the people that love the women in their life, which hence Go Red Month, because this unfortunately does go missed. And this can be pretty traumatic for women if they have suffered, or maybe it's a family member who has suffered this. Support, like educational support, emotional support, meaning making sure you understand like the resources that are available to you, whether it's working with a health coach, a nutritionist, to understand like what lifestyle changes need to be adapted now, and making sure that you understand what your treatment options are and helping you cope with what this major life-changing event. So it can be pretty traumatic for people. And then obviously the importance of advocacy and policy is just basically it's increasing awareness. So the more people that are educated, the better the outcome. Because if you have a loved one in your family and you're like, something's just not right, or if God forbid it's you, you know that you can advocate for yourself because you understand what the risks are and what some of the atypical presentations are. And in summary, we understand why it's important to understand this prevention strategies and effective management. And again, time is tissue is the mantra. And so we want to make sure that we understand what some of the symptoms are, that they're not always common, and that we understand what some of the treatment, some of the treatment options are and what some of the prevention strategies are. So if you're a high-risk person, possibly you want to make sure that you're looking at your pantry and not adding fuel to the fire, so to speak. So I will pass this off to a very good colleague of mine who I'm happy to share this day with, and he will introduce himself. And thank you for your time.
Thanks, Chris. So Cris Valerian, I'm a ER doc with over 25 years of experience, and I've been working with Cris for years on the wellness and holistic side, and I say that I really like her approach to clinical practice, which very well aligns with my approach as well. And this topic of women's heart health is one that's near and dear to my heart as well. No pun intended, because I have a family member who had a heart attack at less than age 50, and I was there and witnessed it at the time. So let me just share that a little anecdote with you about how that impacted our lives as a family. We were a car full of family members on the way to a graduation for another family member, and she was in the back seat of the car and started texting my brother-in-law, who was sitting next to me in the car I was driving, and said, I'm not feeling well. Something's not right. I have some chest pain. I'm not sure what to do. So as I'm literally driving the car with a car full of people on the way to a family event, I was like, we're on the highway. It was a couple hours away. I just pulled over on the side of the road and sort of got out of the car and did just a quick assessment and talked to her, and just something didn't look right. She said she'd been having some indigestion and some heartburn, and it just wasn't going away. It's been there for several hours, and she just didn't look right. So I said, let's just stop by like the closest urgent care just to get an EKG or get you checked out. So we did that. So we sort of pulled off at the next exit, all 7 of us in the car, and pulled into the urgent care and got her checked in, and they did an EKG, and the EKG, like Chris had said, it wasn't crazy, like, oh my gosh, you're having a heart attack. It wasn't jumping off the page. It wasn't normal either. It was sort of something in between, what we call indeterminate. So then they continued to do some further workup, and she got her blood work back, and the blood work is what triggered the diagnosis and showed that she was having an issue going on with her heart that would indicate a heart attack. So we ended up transferring her to the emergency room, and she got a full workup, and sure enough, she was having a heart attack. And the whole time she was sitting there talking to me, just sort of matter of factly, and, yeah, I got, it hurts and it's just not going away. And it wasn't like, the worst pain of her life. It wasn't the worst thing that's ever happened to her. She was just kind of, having normal conversations. So long story short, it was a heart attack. She had a full recovery. She's on medication, and like Cris had said, made some dietary changes and lifestyle and behavior changes, which my brother-in-law was was happy about, I guess, when cleaning out the pantry there. But anyway, point of the matter is, it literally happened to me, or a family member, I should say, that impacted all of us. So it is true that it can happen to anyone. It can happen at any age. She was, I think, in her late 40s at the time when that happened. So having said all that, I think, the importance of this topic is that heart disease, cardiovascular disease, is still the #1 killer of women in the United States. You may think, breast cancer or some other ovarian or uterine issue, but it's not. It's still, a woman is still more likely to die of a heart attack than any other disease in the country. So it is definitely an issue that needs to be on the front of people's minds if they're having symptoms. And the other problem with females and heart attack is that they are usually not the typical presentation. So, the classic presentation that you may see in a movie, or you're reading a book or online or whatever, of this, chest pressure, radiation to the neck or the arm, shortness of breath, just sort of, this overwhelming, crushing chest pain is just not usually what happens with women. They usually have what we call an atypical presentation, very like what I described, just sort of not feeling great, some GI type symptoms, some gastrointestinal symptoms, some nausea maybe, and it kind of lingers. Women have a higher threshold of pain than men do in general. They're just designed that way in nature. So women are less likely to complain about chest pain in general, as well as a general concept. So if a woman is complaining about chest pain, that always triggers to me, a higher sensitivity, because they wouldn't be complaining unless it was really bad, kind of thing. And it's well documented that, chest pain is not the primary reason that women usually would go to the emergency room for when they're having a heart attack. It's one of these other symptoms, which we'll talk about in just a second. In women, there's really no difference in race as well for heart attack. So women are equally likely to have some sort of heart condition regardless. However, women are more likely to have some other health problem going on if they have a heart attack. So diabetes or high blood pressure or some other issue, whereas men may not have that those other coexisting problems and still have a heart attack. Women usually, or are more likely, I should say, not usually, but are more likely to have some other issue going on. And it may be undiagnosed. They may not even know about it. But, as they get worked up because of the heart attack, you'll identify some other issue that was going on. And then finally, on the sort of differences component, women tend to have this sort of slow, lingering kind of set of symptoms for a day or two, or even a week before they come in, which may include just like not feeling great, some sleep disturbances, some anxiety, just, things just aren't sort of settled. And they may blow it off because it's not, a major issue, or it may be just part of normal stress and anxiety in life that just, kind of gets in the way. So, but when you talk to women that have had heart attacks and you ask them sort of how they were feeling the couple of days leading up to that event, more likely than not, they will say, I wasn't feeling great for a few days before that. And even like I said, sleep disturbances, tossing and turning, sort of generalized jumpiness is a well-documented situation. So having said that, what are the symptoms? I just said that they don't have the typical symptoms, right? They kind of didn't read the book as far as the presentation. So what do they have? Well, they may have that shortness of breath, the chest pain, some radiating pain, nausea, maybe even vomiting. But in addition, they may be sweaty, they may get lightheaded, they may have indigestion. Very common to report heartburn. They'll point to the center of their chest and say, I'm having heartburn symptoms that just aren't going away after taking Tums or Pepcid or some medication. So a lot of gastrointestinal type symptoms often get mistaken in women for a heart attack, or a heart attack for gastrointestinal symptoms. But they may also have a cough or anxiety, or like I said, sort of generalized, just not feeling right. Loss of appetite for a few days, as well as another common symptom that they'll see. And again, that may be welcomed by some, especially in this day and age of GLPs and weight loss and health and wellness and everything else. But again, if it's part of a multi-symptom situation, it needs to be taken into account. So those are the sort of typical, atypical presentations of female heart attacks. So what do you do? The key is to have a high index of suspicion. So the key is to be aware. And like Cris was saying, the whole reason we're doing this and the whole reason for the Heart Month is to go Red Heart Month is because we want to raise awareness. So people need to be thinking about these things. So if you are suspicious that something's going on, obviously call your doctor, or if you feel it's emergent, go to the emergency room. And the problem is a lot of times the EKG is not enough alone. So you want to be aware that if you're having persistent symptoms, if things are not getting better and your EKG is normal and you're not getting other testing, push for further evaluation, push for further diagnosis. Like Cris had said, advocate for yourself or your family or your loved ones or your friends. The blood test that I had mentioned is a quick, simple test that's done in the emergency department. Every emergency department in the country has it. It returns results quickly in a matter of minutes. And it is, although not 100% diagnostic, it is in combination with other tests a very sensitive way to identify if you are having the heart attack. Maybe someday there'll be some sort of home version of the test or something, who knows, but right now there's not. So you do have to go, which by the way, if you're having a heart attack, you probably don't want to be at home anyway. So you do need to get evaluated, but the combination of an EKG, the blood tests we're talking about, they may do an echocardiogram, they may do some other testing as well if things are just really suspicious and not diagnostic at the time. But again, push for that full evaluation until you have an answer, because pain is not normal. You should not have pain, so there should be a reason for pain, always identified. So then finally, really just in summary, the key messages from my perspective are, be aware. Have a high index of suspicion. If you or someone has these sort of weird kind of symptoms that all stem from a chest-centered or cardiac type situation, then get checked out, get evaluated, go to the emergency room or urgent care, whatever you have available in your area, and push for that evaluation. Unfortunately, it's sad, but 30 to 40% of heart attacks in women in this country are missed every year, which is just unheard of. In men, it's less likely to be missed. There's still heart attacks that are missed in men as well, but it's a much lower percentage, and that's usually for different reasons. But in women, like I said, 30 to 40% of the time we're missing the boat on that, which is just not good. So happy to have any further discussion if you'd like, but that was my message.
Thank you. I think if there are any questions, Kristen, what do you think from the audience? The sleep is really not something I knew, actually. I did not know that. So that was really helpful information. I did not know that.
Sure.
But yeah, I guess if there's no questions, then we can wrap it up. Wait for Kristen, who's moderating. Thank you. Thank you for your time.